Well, we began to lend money to the poorest people. This is how we started our work back in 1976. It's only few people in one village. And then we started expanding our work to next village and the next village, doing the same thing. Since we are working with the poor, one thing kept coming to our notice right away: how poor they are in health. Poor in income is also poor in health. And one way, in a concrete way, they started noticing is the night blindness among the children of the families that we are working with. And I see these kids go blind after sunset. They can't see anything. So I was wondering what happened. Is it something, a defect in the birth? They said, no, it's simply deficiency in vitamin A. So if they take vitamin A, their problem will be solved. So we took it from there and started promoting vegetable gardening, because there are plenty of vitamin A in vegetables, particularly in colored vegetables. And we became a very active promoter of vegetable gardening. And we started selling good quality seeds. And soon, as we grew, at one point we became the largest seed seller in the country, because we started selling seeds as a social business, not to make money for ourselves, but to make sure the cost of providing them seed is covered by the prices that we charge from them. So in the process, night blindness disappeared. Then we got involved with sanitation. We made it a rule: as you join Grameen Bank, you have to dig a hole and use the hole as a latrine, because people are not used to do this in a particular place. They will do it out in the open, very publicly. And that has spread the diseases. So we said, no, we can control these diseases if we only make this happen. So it became a standard procedure in Grameen Bank. We started giving loans for water-sealed, hygienic latrine. Now the borrowers have hygienic latrines with the Grameen Bank financing. It doesn't cost much, but a small amount of money. We provide them as loans to do that. And then we started doing, since we are getting bigger and bigger, we thought we should create a separate company, a company which will look at the healthcare issue very focusedly. So we created Grameen Kalyan to bring that health services to the people of Grameen Bank and beyond the Grameen Bank. So we started setting up clinics and as a social business, where our focus will be on prevention. And these will not be dependent on the availability of doctors. So these will be doctor-less kind of operation, where prevention will be the focus. Next emphasis will be on early detection and early treatment. And the group of people that will be putting highest priority are the women, and the next highest priority will be children, and the next highest priority will be the adolescent girls. The reason we focus on the women and the children and the adolescent girl is they are the hardest to reach among the poorest and among any level of income. So we thought we'll focus right on them, so that when we make it happen, other things will become simple. We will not ignore anybody, but we'll start with the priority. We want to make this health center as a very strong diagnostic centers. All kinds of diagnostics services will be available here. We'll train the young girls, high school graduates, to become expert on using these diagnostic instruments. And this will become their independent entrepreneurial activity. They will go house to house, checking up health for the people, identifying the diseases, so that we can do everything possible in diagnostic services, identification of diseases, and management of treatment to serve the poor people, and how to make it happen, how to make use of the information technology in the best possible way, so that their services can provide good quality healthcare service around the country.